Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras, a Changing America. I'm Anthony Moreno. Today on the program, we learn about a study mapping how inclusive services are for immigrants in Doña Ana County. Joining us is Dr. Megan Finno-Velasquez, Director of the Center on Immigration on Child Welfare, a project of New Mexico State University. Dr. Finno-Velasquez, thank you so much for taking the time to talk with us.
Yes, thanks for having me.
Can you give us an understanding about this study and what you took a look at?
Sure. What we did for this study particularly, it had actually multiple parts. One of the parts was based on a need for immigrant inclusivity that we found in several organizations that they were struggling with. So basically, we conducted a mapping project whereby we interviewed several different organizations throughout Doña Ana County to measure the degree to which these organizations are inclusive of the immigrant community with respect to different policies and practices around, for example, law enforcement and interactions with Immigration and Customs Enforcement with regards to service eligibility and documentation, language access, immigrant-focused outreach, immigrant-focused trauma-informed practice, et cetera. Because we wanted to understand the capacity for serving immigrants that existed throughout the county. We actually interviewed 58 organizations across a range of health and social service sectors like medical and mental health services, early childhood education, housing needs, food, nutrition, et cetera. And so that was one part of the project. And another part of the project, a larger part of the project, has been going on for the past 3 years. But the most recent phase involves collecting in-person surveys with 240 caregivers of young children throughout Doña Ana County, the caregivers who are immigrants to the U.S., meaning that they're not born in the U.S. And in addition to these interviews, we conducted 5 focus groups with 36 survey participants throughout Doña Ana County as well, because we wanted to learn about the service needs and service use for, again, these kinds of services like health, mental health, housing, food, income, legal services, early childhood education, et cetera. And we also wanted to gain insights on immigrant caregivers' needs themselves across a range of mental and emotional health needs. And so it was kind of a multi-pronged study, and we actually just completed it a few months ago.
Okay, now can you kind of give us an understanding of just the population, the immigrant population in Doña Ana County? What is it like compared to perhaps other places in New Mexico?
Well, Doña Ana County, I think probably, as you know, is pretty unique. It shares borders with Mexico, with Chihuahua, Mexico, and with Texas. There's some different interesting pockets of Doña Ana County within which immigrants reside. Northern Doña Ana County is home to Hatch, and that has a large immigrant population and strong ties to agricultural work, which is not necessarily the same as we see throughout the rest of the state. Southern Doña Ana County, as you know, is home to Chaparral and many other colonias like Sunland Park, Santa Teresa, which also are these unincorporated communities which border Mexico and are pretty unique to this area. And So social services throughout Doña Ana County tend to be centrally located in Las Cruces, and there are significantly fewer available services in the northern and southern areas for families in general, but also specifically for immigrants who may have other kinds of difficulties in accessing services in this particular area than they may in other places. For example, because of immigration checkpoints that surround the county in every direction. That impacts immigrants' decisions at times around traveling and where they may want to travel in order to access services that are located in Las Cruces. It makes it difficult to access services, for example, Chaparral.
Yeah.
And yeah.
So
there's also, go ahead.
So, obviously there's you have the checkpoints, that you also have mountains that and transportation that may be some barriers perhaps for some folks. But I'd also like to hear, just in trying to get the information you needed for this study, was there any challenges with engagement?
That's a really good question, and I think that is always a question at the forefront of any researcher's mind when we're trying to be sensitive about accessing this population, a very disadvantaged population, a population that naturally would be potentially mistrusting and not necessarily willing to talk to just anybody about their experiences. And so we very intentionally designed this study with the community. And we had several community agency partners we've worked with throughout the whole process, and an advisory board of community members, some of whom are immigrants themselves. So we aimed to be as sensitive as we could to some of the potential misgivings or concerns or hesitation to participation that there might be. And in terms of engaging immigrant caregivers themselves, we were actually very successful in meeting our timelines. And really, I think the most important factor in that was that our field interviewers, or the people who were doing the surveys, were doing them in person, and they were going out into the community. They were going into the schools. They were building relationships with churches and going into churches. They were in early childhood centers. They were at community events, and they really hustled to create visibility amongst themselves and the studies, and to take as much time needed to talk to people who were interested in participating but might have had some misgivings. Another important factor is that everyone who was staff on this study was bilingual and bicultural in Spanish, and had some ties to the immigrant community if they were not already immigrants themselves. And so it was very important to us that the people who had the direct contact with our population were part of the population themselves, were part of the community themselves. And so I think that helped with any of the kind of engagement issues that we might normally expect.
One part of this study that you looked at was access to financial capital for immigrants. Can you give us an understanding of what you're able to find out there?
I mean, we didn't actually look at access to financial capital, so I don't know exactly what.
Okay, so I saw there was a section in the study, financial and social capital. So can you share anything about that? Was there any challenges there?
Yeah, no, I mean, we didn't talk to immigrants directly about, we talked to them about whether or not they've used or needed, for example, income assistance. And so there were some interesting results there. Actually the highest need or disparities in service needs that existed that from the families that we talked with was related to housing. Housing tended to be was the service that people most often needed that they weren't necessarily able to access. Of course, there was need and use of income assistance in some cases, but there's lots of reasons and barriers identified around accessing those types of services, mostly around, besides just basically not knowing where to go to get the types of assistance that people may be eligible for. That was one surprising finding, that even when financial assistance or food assistance or housing assistance may exist, folks didn't necessarily know where to go to find it or how to access in a lot of cases. Also, language barriers. It still remains a big one, even in the Spanish-speaking community, where, if someone was referred somewhere, they just didn't end up with someone who could speak to them in their language in a way that they understood and help them kind of navigate. In terms of financial and social capital in general, I mean, accessibility to services is multifaceted. It does encompass financial capital and social capital, but what we were focusing on was about the inclusivity within systems that may or may not serve the community through an immigrant-focused lens specifically. And so that's what we were targeting, were the systems that are designed to address some of these needs that may exist. How well are they addressing immigrant needs, basically?
So looking at those systems, was there any that stood out to you and your organization as a system that really needs some improvement in addressing the needs of the immigrant population in Doña Ana County?
Yeah, we had some interesting findings. I think across all of the kinds of service types that we examined, we found a few basic things. The majority of organizations, regardless of what kind of service they offered, they don't actually have policies prohibiting interaction with immigration and customs enforcement, which could be a way to protect immigrants and to offer a more safe feeling kind of space for people to go to. Only about a quarter of the organizations that we interviewed actually correctly identified their protected area status. And I'm not sure if you're aware what a protected area is, but it was formerly known as sensitive locations. And these are areas where enforcement actions of immigration agents or like ICE officers are restricted. And so these protective areas include schools, health facilities, places of worship, public demonstrations, a lot of the places where people would go to receive services. And most of the organizations didn't know that they were actually considered a sensitive location or a protected area. So in that way, if they did know, they would be able to advertise that to families and to the community that their organization is a safe space for people. And so that's one area where we, see that most organizations across the county can probably improve on. We also, unsurprisingly, there are still some language access needs. So about a third of the organizations that we interviewed don't have a written language access plan that spells out how to provide services to individuals who are not English speaking. Although most organizations did report offering interpretation and translation services, several of them, at least 10 to 15%, I believe, still don't even have a regular way to offer translation or interpretation services if they don't have staff who speak a language that a client or might speak.
Yeah, a lot. I want to dive into some other issues here, though. Just learning more about inclusivity. You mentioned folks had a lot of trouble with accessing housing, which I mean is a big issue in New Mexico, no matter what county you look at right now. Also, one thing that I'd like to talk about is food and nutrition, accessing healthy, nutritious meals. Any insight there with the surveys that you conducted?
Yes, we do have a full report online. In terms of food and nutrition, food assistance was a need. About almost everyone we interviewed, over 90% of participants identified needing food assistance, and almost that amount had reported having actually accessed food assistance. And that may be because there are forms of food assistance available in the county that are not necessarily just government-based. There are lots of nonprofits. Food assistance is offered through churches, through schools, et cetera. And so there's lots of different ways that families can access food. And it didn't seem to be a huge problem specifically in this community. Like, yes, there's a need for food assistance, but also, yes, this community seems to be accessing what's available for the most part when it's needed.
What about healthcare? How inclusive is healthcare in the county for folks? You mentioned certain disparities within the urban populations, but when you get to the north and the southern part of the counties, there seem to be some issues.
Yeah, the most interesting thing is medical services for children and adults across the board, and the caregivers themselves. Their families seem to be able to access medical services and dental services for their children pretty well. There does seem to be more of a disparity in accessing medical, dental services, and mental health services for themselves. So whereas we found, just for example, that about 86% of everyone we interviewed needed medical services, only 76% of them had been able to access them. And so there was at least a 10% disparity in terms of people who can't even access basic medical or dental services for themselves. It's a similar number for mental health services as well.
You brought up the interactions with law enforcement, protected spaces. Can you give us an understanding about concerns regarding law enforcement interactions within the immigrant community?
We conducted, yes, I can talk about that. We conducted 5 focus groups in which the participants discussed at length, I think, what some of their fears were around engaging with law enforcement or coming into contact with law enforcement. Not just local law enforcement, but ICE and Border Patrol officials as well. Partly the fear is around, even around, transportation and accessing any services because of transportation issues. But there's also widespread concern around the public charge, and there's still misinformation around the current public charge rules that were changed during the Biden administration to become less restrictive after the Trump administration created more restrictive public charge policies, which essentially created this chilling effect, and that is making people very hesitant to access any kind of social service, basic kind of support, basic income, food assistance, any public benefit that they might perceive could then be a problem later on if they are attempting to obtain legal permanent residency or citizenship in the U.S. There's lots of misinformation around that right now, meaning that the current public charge rule for the vast majority of these public benefits, it doesn't actually make a difference whether or not people receive or get most of these public benefits, it's not going to necessarily be counted as a public charge and impact their immigration status later on. But the fear that lingers is that people in general are very aware that our immigration policy fluctuates a lot in the US depending on the federal administration. And so people aren't necessarily willing to put themselves out there right now, knowing that we could have a different president who could change the rules again, in 3 years from now.
Okay.
So there's just still a lot of misgivings and mistrust around accessing services for themselves, but also for their children.
Okay.
Children, most of whom are U.S. citizens themselves.
Okay, thank you so much. Unfortunately, we're out of time. Dr. Megan Finno-Velasquez, Director of the Center on Immigration on Child Welfare Project of New Mexico State University. Thank you so much for taking the time to talk with us.
Thank you.
Moving on, we now learn more about a local artist who finds inspiration from the Chihuahuan Desert to create art that combines ceramics and steel. In This Living Here, producer Christian Valle shares more on the work of artist Suzanne Kane.
I enjoy working with ceramics and I enjoy working with metals, and so I most often put those two together and I build things. I love ceramics because they're very forgiving and mushable and immediate, and I love metals because they're strong and hold things up really super well, and they have a real permanence to them. Well, I've always been a maker of things, so even when I was young, I come from a family that's very handy and makers, and did a lot of different things when I was growing up. Right now, I really am taking a lot of inspiration and joy from our desert here, the Chihuahuan Desert that we live in, and this landscape. And then I am just responding like crazy to these weird plants and seed pods, and I could just doodle around with that all day long, every day, and maybe take a hike in between to go find some more inspiration. And people are responding to those too. I really think that when you're in your studio working, time is this weird relative thing that you have no idea. Has 5 minutes gone by or has 2 hours gone by? It's really an odd state of time. Clay kind of, sometimes you just want to play with it and it helps you get an idea. Work with the clay on a shape. It feels like it has some poof or some volume from the inside. Weeds kind of, they explode outward, sort of. So they kind of push outward. And I love the way clay just responds to that kind of pushing and pulling. Oh, that's kind of nice definition right there. It's kind of nice to me. There, like that. And then I just like that organic gooiness that the clay has. My favorite part is being able to carve down into it. And it's just bites down in there really nice. And I like to have in my work, you know, when you see a thing and you want to take a second look, I want it to have that depth. I want it to not just be a one-liner or a wow look and then you walk away. I want it to be, I don't even care if there's a wow. I want you to be like look twice, and then maybe in your mind's eye you think about it later. Ooh, I love public art because it's splashy and it's fun, and you get to make big stuff, and there's all different kinds of people. It's accessible to everyone, no restrictions. You're walking down the street and there it is. Few of my public pieces that I've made are here in Las Cruces on the plaza. I made the gates on the electrical building. Made a piece for Eastern New Mexico University. They can see my work at Cutter's Gallery here in Las Cruces, Mariposa in Albuquerque, Santa Fe Clay in Santa Fe. I have a gallery that carries my work in Cottonwood, Arizona. You can always look at my website, which is SuzanneCain.com. I have many pieces of advice for aspiring or working young artists. I see the drive and the passion to want to be in that world. So you have to have a dedicated space, and it can start as like a postage stamp corner in your kitchen. And number two is then you have to work. You have to do it. The experiences that I've taken away from being an artist, is that you can always get better. And no matter where the heck you are or what the heck you're doing, you can always get better. So it's great and it's exciting where you are, but then how exciting that you get to go get better. I love that.
Thanks for joining us on the program this week. I'm Anthony Moreno. We'll see you next time.